Children are always screened by the pediatrics. They have special machines to check their vision and if there's any abnormality in the eye reflex or the lens or the vision. If they see there is like multiple investigations done at the age of 2 and 3 and 6, like for instance, and if they feel there is something wrong with the eye, they will send them immediately to the ophthalmologist. Otherwise, if the parents should look after the children's behavior. If they see like the child is squeezing, squinting or whatever, or if they say anything abnormal, so they will come to us. But normally we don't need to examine the babies if they are born normally. If they are born before, let's say, the delivery date and they need like oxygen, they need special treatment, so we have to screen them after their delivery to check the growth of the retina, which is a different story. But regular checkup, it's normally run by the pediatrics. They can check them and see if there's anything unusual, they will come to us. And then mainly the children, what we examine is the motility, the movement of the eye, if they squint or not, how is the vision, is there any difference between both eyes? To catch this, if there's any difference between both eyes, could lead to a lazy eye. So this need we to fish it out before it's too late. Let's say between 25 and 35, let's say most common, or all ages, the dry eyes, which is very common here in the environment that we're living here with the air conditioning, the computer. Let's say the computer is the modern disease of the eye, so it causes a lot of dry eyes, headaches. So we do have people who do overwork on computer like for hours and hours and hours, they do have dry eyes. This is the most common thing, let's say, among adults. The older the patient, they do have, it's not a disease, let's say, weakness in the near distance when they all need reading glasses. And the modern world, the people, they do want glasses, even like reading glasses, they want to get rid of the glasses. This is what we come and see. Let's say in the community here in Dubai, because we have young generation, it's different than Europe. In Europe, we have more elderly people who have cataract, which is the cloud, like when the lens gets more cloudy, with the time, with the age. So we do have more cataract, we have more retinal issues because of the age. But here we have very young population, so it's really different than Europe. Okay, so let's divide into two groups. The children, until the age of 5 or 6, I would say they should not touch the mobiles. But most of the parents, they want their children like to distract them with this, which is unfortunately is socially is not good and for the eyes not good. So I tell them until the age of 6, maximum like 30 minutes, and then between the age of 6 and until 12, let's say an hour, not more, because the theory behind it, the more you focus on the screen, the brain will ignore the far distance and it will cause more myopia, which is the short-sighted vision. I mean, the study shows that the myopia has increased about 60% comparing to the 80s. So it is a very major. So the adults, we say, because they are all work computer, just take a rest, drink enough water, have a proper light, the screen, the height of the screen, the way you're sitting, take a break from time to time, use the 20-20 rules, every 20 minutes have a rest for 20 seconds when you're looking at the object, which is like 20 feet away. These are the recommendations. So when you go back home, the best recommendation is like turn this off hour before you go to sleep, because they say that the blue light coming out of the mobiles could affect like the hormones in the body and cause like sleep disorder. And the worst thing that you can do, sitting in a dark room and having the full screen into your eyes, so it could cause eye strain because it's overstressed to the eyes. I didn't see it honestly, but a lot of patients, they say, there are some case reports about, let's say, issues in the retina or like blurry vision, whatever, but I personally did not see anything until now related to the COVID directly, honestly. But there are some case reports worldwide, but I personally didn't see anything.
Thank you.
Okay.